When people think about remission in arthritis, the first thing that comes to mind usually is medications. What medications are you taking? And I know this because I'm a rheumatologist, and that's probably what we spent most of the visit talking about, is how you feel on that medication. Is it helping your inflammation? Is it hurting it? But there's something that we really don't talk very much about, and it can really impact remission. And that's mental health, specifically depression. And depression is something that can make or break your remission. And many people don't even realize that. If you have depression, what's your chance of even getting into remission? Well, there was a study from the Netherlands that just talked about that. It found that depression cut the remission rate by 55% in rheumatoid arthritis patients and 76% in psoriatic arthritis patients. So here we are thinking that our medications are going to be amazing, wonderful, calm the inflammation right down. And yet we're not talking about something that can really matter, and that's depression. Why is this? Because it's not just in your head. Depression can affect the whole body. It's linked to more joint pain, more inflammation, and a tougher time managing the disease. So this actually tells us something very powerful. Treating depression is treating the arthritis. Addressing mental health can improve those outcomes and help people feel better in their body and mind. I do bring this up often with my patients. I think that they're depressed, or they tell me that they're depressed. And when I ask them what they're doing about it, are they seeing a mental health professional? Are they considering medication? A lot of times it's like, no, I'm thinking about it. I'll take care of it maybe later in the year when I have more time. But it's not something that they're addressing right now. And yet majority of people, when you have a rheumatic disease, you have to see a rheumatologist every 3 to 6 months, somewhere usually in that interval. So you see us pretty often, and yet we're not taking care of that one main part, right? The mind, which can influence so much. So if you're struggling with arthritis and you're feeling down, don't brush it off. Talk to your healthcare team. It's not just about feeling better, it's about doing better overall.